Spread across the more than 7,300 islands of the archipelagic nation of the Philippines are more than 100 million Filipinos. A majority of them live in urban regions where there is access to job opportunities, education, entertainment, and crucially, healthcare. But for the rest living in more rural areas, the same access simply isn't there. The healthcare situation remains the same. People give birth and get sick, with afflictions ranging from a simple whooping cough to full onsets of tuberculosis.
This demand is met with low supply, and has been for decades, so that the healthcare system in rural areas remained weak. Then the coronavirus happened.
The 38-year-old female Chinese patient under investigation is positive for the novel coronavirus.
The Philippines reporting the first coronavirus death outside of China.
Land, domestic air, and domestic sea travel to and from Metro Manila shall be suspended beginning March 15, 2020.
Long before the pandemic, there was already a clear misdistribution of physicians in the Philippines. Medical doctors, especially specialists, have established their practice in cities and urban areas. Rural areas, where the Philippine Statistics Authority has estimated 54% of the population to reside, are serviced by only 30% of the active medical workforce.
There is a discrepancy really in the distribution of the health personnel. There are a lot of factors that we can see in that situation. The political influence now is very, very strong. You are qualified. If you are not affiliated to this person, you cannot be hired in our setup now.
This is Dr. Adelaida Rosaldo. She's a family physician and full-time faculty member at the University of the Philippines School of Health Sciences and chair of their medical department.
The facilities, equipment that they need is also mostly found in the urban centers. Opportunity-wise, they thought it is better to practice in the urban centers because of the availability of equipment or other resources.
Beyond the issues of healthcare service in rural versus urban regions, there's also the disproportionate way physicians would rather practice in a private than in a public setting. Whatever the case may be, though, the bottom line is clear. Healthcare is only for those who can afford it, which only exacerbated the tragedy to come.
Our healthcare workers are falling ill as they take care of patients.
139 facilities nationwide are at danger level.
Actually, among public health workers, there is still the risk, the exposure to their lives, setting aside the compensation that they get. Aside from that, because of the bulk of the works, doctors also have this burnout.
This last one, burnout, is very important.
See, it is entirely possible for whole municipalities containing hundreds, if not thousands of families to be serviced by only one public physician, which became of particular note last June 2020, when the Philippine government announced its plans to deploy doctors intended for rural regions and far-flung areas to an overloaded urban healthcare setting.
It is to the disadvantage also of the municipality that they are assigned to if they will be pulled out, because who will take good care of the population in that area? To note that there is no boundary when it comes to transmission. The virus can infect anybody, may it be you are living in the rural area or in the city. All of us are vulnerable.
At least 2 million people in the Philippines are begging for help.
Looking at the aftermath of one of the strongest storms ever to tear across the ocean and smash into land.
It is a miserable, miserable situation here.
The kids are dehydrated. Most of them are suffering from diarrhea and vomiting.
7 years ago, Super Typhoon Haiyan brought destruction to our country and our city of Tacloban. Like during this pandemic, rural healthcare immediately after the typhoon, and even long into recovery, suffered the consequences and effects.
globalization and scaling up of the effect of climate change, we are now experiencing that we need to prepare more in that aspect. Aside from that, those infectious diseases, we are still experiencing an increasing number of HIV patients and other infections, especially the diseases that can be prevented by vaccine.
These issues in healthcare make strengthening rural healthcare all the more important. This needs governmental attention. Through a more proper alignment of resources to strengthen the healthcare system, it is ensured that anyone, anywhere in the country, is provided access to this basic human right.